For those of you that are new to joining us in the room, I'm Dr. Lucas. I've been in general practice and ER, own my own practice in Kansas City, and I call myself now an open-minded skeptic. I was initially very skeptical of acupuncture and chiropractic and, you know, lots of different things that I could go into, but when I decided to use Ozone, it was for my own dog who was dealing with a high-grade sarcoma, and have been able to use it since then in many, many cases that we discussed mostly in the second hour, but at this hour, I'm going to try to pull it all together. So we already talked about mechanism of action, how it works, what it does, how we can use it. And again, all of that's in this book. There's YouTube videos that are available for free. There's Ozone training seminars that you guys can attend as techs or veterinarians, and there's even some that are geared towards pet owners if they need more information. But I'm going to wrap up this session by kind of talking about how we combine treatments, protocol dosing, other resources, all of that. Okay? And please feel free to ask questions. And if I ask you a question, you might get a book. So, like I said, it's being used. Most of us in general practice have no idea about this stuff, but on the holistic side, they've been using it for probably 20, 30 years in vet med. From everything from, as we saw, chickens with maggots to horses that need acupuncture and everything in between. Dr. Judy here is in Pennsylvania. She's what I would call a referral level holistic integrative medicine practitioner. And that's her quote. Like, Ozone is the most, it's at the booth too, like Ozone is the most used tool at her practice. And you guys can use it. You don't have to be board certified or anything like that. It's a hands-on tool that is technician driven once the veterinarian decides where it needs to go. So it's very, very user friendly. And one thing that O3 Vets does that I really appreciate is that they will schedule training times with you guys once you get the equipment, so that you know what you're doing pretty quickly. You feel confident pretty much right from the get-go. Also at the O3 booth, because many of you may be like me, I want to see some proof of what I'm doing, especially if I'm going to invest in equipment. There are big folders, whether it's dentistry or surgery or cancer, that have all kinds of scientific published articles from veterinary journals. There's a lot of pubs on PubMed and NIH. If you want to go peruse that, it's pretty interesting stuff to see what they're doing on the human side too. So ozone generator here. That's not the ozone generator, sorry. That is the second part of what we use when we've been talking in the previous hour, especially about really sick cases like a down and out pancreatitis or cancer in particular. That's when you really need to stimulate the immune system, and the chimp is a UV light generator. You would take your blood sample from the patient that's been mixed with ozonated saline, and then we run it through this generator, the UV light generator. That adds another layer of stimulation for the immune system. There's a whole bunch of scientific explanation for that, but basically the UV will trigger stem cell production and activate the immune system in ways that just ozone by itself doesn't do. So it's another way to add benefit to your therapy when you're giving it IV. That's the only time we use that, is when we're using the major autohemotherapy. Pretty much everybody in this room is using laser of one form or another, it seemed, earlier. When you have an area that's painful, you can inject ozone under that area. You can then come over it with your laser, and you've already hyperoxygenated that tissue. So it's going to receive that wave pulse even better. And the laser is basically working in a similar way to the chimp, but you're only doing it locally, right? So we're using ultraviolet light or UV light, but in the red spectrum, to try to stimulate blood perfusion. We're trying to get more oxygen to damaged tissues or painful tissues and promote healing. That's what's happening, but we're doing it through the entire body. It's like laser for your entire body, if you think of it that way. All the benefits you guys love about laser, you can do with this unit, but it goes everywhere. Here's your horse picture. In Brazil in particular, they do a lot of breeding programs for racehorses. So they see a lot of stallions, a lot of sports injuries at the vet school, and they have found using, I'm sure these are 16 gauge needles, but they'll put them into acupuncture points and then inject like 60 mLs of ozone gas right into those points. And the videos are like in the same session. You got a painful horse, and then immediately after doing even rectal insufflation and getting that ozone gas systemically, these stallions are not reacting to palpation. Like I said in the last lecture, when I had that Frenchie that came in to me last week that was just in agony, I gave him bupe, I gave him Dex, but we also did ozone in his acupuncture points, and he was passed out sleeping and very comfortable within 10 minutes. So it's a phenomenal adjunct to that too. Yes?
So I don't know if you know this or not with these. Are they pre-sedating these horses if they're painful, or do they not because they want to see results?
They're not because they want to see results. I did because that Frenchie was just like, I was afraid to even poke him with a needle in his owie points if I didn't give him some pain relief first. He was really in agony. But that's a good point. Yeah, so in the videos that Dr. Hakim has from Brazil, and he lectured at the Midwest Veterinary Conference in Ohio in February. If you guys ever get a chance to see that, that's phenomenal, what he talks about, because that's the vet school. They see the worst of the everything, cats, dogs, horses, and his cases were blowing my mind. But he has videos of horses that were trying to kick him, bite him, everything, just palpating, going down the spine, striping down by the sciatica, and then he does just rectal ozone, and then palpates exactly the same way, and they're not reactive. It's wild. So you don't even have to know acupuncture to help, is what I guess what I'm getting at. But if you do, it's excellent add-on. All right, for those of you joining us on this one, MBRT, anybody remember what that stands for? Microbiome replacement therapy, or as we affectionately call them in our clinic, the poop smoothie. So my own dog was suffering from crazy anxiety in cars. I gave her a fecal transplant because I had read in human literature that it's useful for kids with depression and anxiety. So I tried it on my crazy kid, and overnight, she was able to be in the car again without pooping in the back seat. Why does that work? Well, we know that there's a gut-brain axis. We're learning so much more about our gut microbiome now, but one thing I didn't appreciate is that the bacteria are what are making our serotonin and our dopamine. If your gut is off, your mood is gonna be off. So that explains to me a little bit why it works so well with Frank overnight, because instantly those guys are making neurotransmitters that she needs for her crazy brain self. When we restore the healthy microbiome in severe cases where probiotics are just not enough, we've all been there. We've all had diarrhea cases, chronic ones. You give them Fortiflora or Visbiome even, and it's just not working. It's just not working. There's something that you guys may have heard about with CBD. It's called the entourage effect, where if you isolate one part of a CBD spectrum and give just that thing, you're missing the benefit of the whole plant. The same is true with Denemeron versus milk thistle. I hate to say it, but that's true. So we can tease out one little part that we know has bioactivity, but the whole plant together is working in ways that we don't always know, how the other components of that substance supports the activity of that main ingredient that we know does the job. So you get an amplified benefit when you give the whole substance. The same thing is true with probiotics. Probiotics maybe have, in the veterinary side, maybe 5 strains, right? On the human side, you're hoping for 10 strains or more for people who have really bad GI stuff. When you're giving the whole enchilada, I don't think they have any idea how many species are in poop, actually. So they're all working in different ways. And that comes back to what I was sharing about Frank. You know, some of them are making hormones, some of them are making neurotransmitters, some of them are making B12 comes from small bowel bacteria. So when we got GI issues, that's why B12 injections sometimes helps, because we're giving something that the bodies can't make, because the gut is not able to make it. That's the reason B12 helps. Fading puppy kitten syndrome. Has anybody had to deal with this? You got a litter of kittens and a client brings this litter that they've been trying to take care of, and one kitty dies, and the next day another kitty dies, and then you know what's coming. So there are 2 ways that I've addressed this. One is to give them serum from a healthy cat, and I'll inject it sub-Q, and that gives them passive antibody. But I will take a turd from a healthy cat and put it in my NutriBullet. We have one that's just labeled poop smoothie. We have a box in our supply closet just for that. I strain it through cheesecloth, and I will tube those kitties and give them maybe half an ml of the slurry, and that will often fix it if I can't get serum. Same thing with puppies. And then the last one is support for cancer patients. And again, because so much of our, we know that the lymphatic system is crazy along the GI tract, which makes sense because you're addressing pathogens that are coming from the GI tract before they go systemically. But also, we're stimulating a lot of immune production. So a lot of our immune function is gut related, and then that affects the entire body. So if we can get the GI tract as functional as possible, then that supports anything else that the body's dealing with. Now we'll get a little bit into protocols. So I told you guys one thing that's super important is that we never inhale this gas, or our patients never inhale the gas without it being nebulized first through olive oil. Otherwise, it's going to cause, extreme inflammation in the respiratory tract. But the other thing that's important is the concentration that we're using it at. Like I explained with my dog Zoe, I used a higher concentration not knowing. Bigger is not always better with ozone. And if you think about it, it's the same with other drugs, right? There could be a very safe drug that we're using, but if we're not using it at the right dose or we're not using it in the right location, it could be fatal. So, can anybody think of a drug that we send home with animals all the time as an injection that if they screw it up on the syringe, we're in big trouble?
Insulin.
Who said that? Not you. You did? You already have a book. You said it? Okay. Yay! All right. Ozone's not fatal like that, but it can definitely cause, it can. Like I said, I don't know if I said it in this lecture, you guys, but people were sometimes mainlining just the gas, and a few people have killed themselves doing that. So it needs to be mixed in saline or mixed with blood, to be given IV safely, with the exception of horses because of their giant vasculature. So one great thing that O3 Vets has provided us with, and anybody that buys equipment from them, is a treatment book. Not this one, but an actual protocol guide based on what other veterinarians who have been using this around the world and in the US have been doing. And they have come up with like a frequency and how much ozone do you mix with saline, and then how much do you mix with blood, and how often are you going to give it, and at what concentration. One thing that's good to remember too is that you also have to look at your individual patient, right? If you have a down and out, really frail animal, you're going to want to start lower doses. So if there's a range, always start low and let them gradually build up their strength and be able to tolerate and take in more of that benefit at a higher dose as they start to feel better. Does that make sense? But you can get fancy and say exactly how many micrograms you want by saying, I want this volume at this amount. I usually just write it in my charts. Like if I'm doing a rectal ozone, I'll say I want 20 mLs at 35, something like that. But you can get fancy and actually calculate it all the way out. It's kind of fun. So here's the table of contents, just like I was saying. You've got all of these different systemic methods of application, the local, and then there's a page number so that you get to see just how it's going to be dosed and the frequency. So again, like I'm saying, you really can get started right away once you get a little bit of training, and then you've got this guide. It's very straightforward, in my opinion, in our experience, it was. So here's an example of a page. Here's that major autohemotherapy with the big M. This is how you would, like you shave. You add a little bit of heparin, and there's a calculation in the book for that too. Draw up the ozone in the syringe, butterfly. It basically walks you all through it. And there are YouTube videos also that show you exactly how to do it. So that's helpful. And then often when how many training sessions do people get exactly, Jonathan? Like if you're wanting extra guidance, you can actually set up an appointment with O3 Vets, and they will get on a Zoom call with you, talk you through it for you. As needed. Okay, yeah. Again, another page on ozonated fluids. I love that, right? There's a weight chart, and you can tell just by looking at it exactly how much you're going to use. Makes it so easy. So you don't need to write all this. If you get a unit, you get the whole, that comes with it. It's just part of the package. I just wanted you to see how supportive it is, how easy it is to use. And then here's a slide of the different kinds of equipment. You have to have an ozone generator, as we talked about. There's an electrical charge that goes through that actually makes the ozone. You need medical grade oxygen. You can use industrial grade, but it's not verified that it's pure. It's supposed to be the same if you went to a welding shop. But I'm still telling people to use the medical grade. You need a regulator. We use these syringes over and over and over again if we're just using the gas. If you're mixing blood, obviously we're going to throw that out. But they last a long time. And a lot of veterinary clinics, we're trying to be frugal. We're trying not to waste a lot of plastic especially. And it's nice that you can keep using these. It doesn't work great if you're using a regular latex syringe with the black stopper. The ozone reacts with that, and it will just destroy that plunger too over time. Doesn't take long. But these silicone ones work over and over and over again for quite a while, as long as you're not using them for blood. These are the little rectal catheters. I don't know if you guys can see this, but there is a line right here. That's kind of the guideline I use for dogs. I don't go any further in than that. Somebody asked me a good question at the break about, so if I can wipe out bacteria, yeast, fungi, if I'm giving it rectally, am I going to cause a dysbiosis? And the answer is no. because we're only going in just to that very caudal part of the colon. We're just releasing ozone in that area. When I do the microbiome transplant, I do want to wipe out all the dysbiosis before I put the good microbiome in. So then you're going to insert that catheter as far in as you can, basically, to get to the transverse colon, to sterilize all of that before you put your good guys in. But when you use it where it's indicated, or like I said earlier with kiddies, maybe an inch or two in to the anal opening, you're just hitting that blood supply. You're really not disrupting anything in the colon. And then on this far side would be some of the bags that you can use on legs, and then the big glass bubbler that we use in our clinic. We just pour bags of saline in there, and it goes through a bubbler and ozonates throughout the day. We don't run it all day, but we'll fire it up in the morning, and then as we need it throughout the day, we hit it for like 5 minutes before we use it again, just to refresh it. Some resources. On the O3Vets website, you can find the evidence library. So it's hard to take 3 hours or even 1 hour of what I'm telling you guys and take it back home and try to convince everybody on the staff sometimes, right? But if you go here, there are videos, there are the scientific publications, there are books on ozone therapy, testimonials by other veterinarians that are using it across the U.S., and then other websites that you can check out for more information about it too, also for yourselves. So that's something that I'm finding really interesting. I don't just think about my critters, I think about my family, and I'm realizing, oh, my mother-in-law could probably use a limb bag because she's getting lymphedema, different things that haven't worked for her so far. Maybe this one will. And there is, to my knowledge, at least one ozone clinic for people in Livonia, Michigan. Some of the books, because ozone therapy was becoming more popular and getting more pushback, just like we talked about with acupuncture and chiropractic. The established medical profession can sometimes push back on some of our therapies that we now know are fine, but back in the day they weren't. So same thing was happening with ozone. So in Madrid, Spain, they came up with this declaration on ozone therapy, basically study after study after study to verify the validity of the treatment and the safety of the treatment. So that's like the Declaration of Independence for ozone therapy, I guess. But then many, many other articles. There are ozone therapy organizations. There's a big one in the U.S. on the human side, and many across the world. But it's up and coming on the veterinary side. So you guys are cutting edge. Here's one of the papers talking about using ozone in a rabbit tumor model, and that's all they used, and they gave it in the abdomen also to get absorbed. I don't know why they did that and not rectal, but they didn't use any blood. They didn't do any major, and it still resolved that squamous cell. The coliform mastitis that I was telling you guys about, the studies that were done without the use of antibiotics, being able to resolve like an E. coli mastitis in a cow, which is amazing, without antibiotics. That brings up another point. We know that we're finding more and more cases where our antibiotics of choice are not working, even Baytril or Cefpo, sometimes ears and bladders. So this gives us another tool to help animals like that when we have exhausted all of our regular medications. Or, like I said earlier, if you can really flush that ear and lavage it with ozonated saline, you're just that many steps ahead of the game because you've already cleaned and reduced inflammation by doing that. Again, in riding horses, using the acupuncture points and putting ozone in those. And as we talked about earlier in, I think, the second session, that it's being used on the human side for people with herniated discs instead of surgery. And they're finding a resolution by injecting ozone into the paralumbar space, on either side of the spine. And there are some places that are using it with fluoroscopy and actually injecting right into the disc in people. In Brazil, they are starting to do that in animals too, but a fluoroscopy unit is something you're only going to get at a vet school. So that's not for us, but you can inject on either side of the spine and get results for pain relief. So just more studies. This one was like a meta-analysis looking at many different publications and taking conclusions from that. Main use of ozone therapy in diseases in large animals, a review on that. Ozone therapy in veterinary medicine, another review. You can see published by people we know. Lots of veterinary textbooks are by them. Overview of ozone therapy in horses, emerging healthcare solutions. Prevention of dental plaque formation in dogs. So you can, again, it's so unstable. Once you make it, you have to use it within 30 minutes. But if you have a dog at home and his mouth is disgusting and you want to rinse it continuously, you could do that every day. But it definitely helps at the time of the dental. And then effects of ozonated sunflower oil for Giardia. That one I don't know about. I'm going to have to read that one. I don't know if you squirt some oil up their butt that's ozonated. That would be cool, because Giardia is also a pain in the rear, literally. And then there's Chaz again. That's my boy with his chew stick stogie. And that's all I have for you for now. Just open for questions. Yes?
I have two. One, if you use the ozone in the ear, what are complications that could arise with a ruptured eardrum?
None, because it would be like irrigating with saline. That's really what you're doing. So you don't have to worry about any adverse effects other than what you would see with saline. So you can get a little vertigo if you get into that middle ear canal, but they probably already have some of that inflammation. But you're actually it's so much more beneficial than saline because of the antimicrobial benefit and the anti-inflammatory benefit. But you're also reducing swelling.
Could you do just gas instead of...
Oh, so I'm sorry. She was asking, is it okay to use ozonated saline if you've got a ruptured tympanic membrane, ruptured eardrum? And yeah.
Could you do just gas instead of the saline mixture?
You could just do gas instead of the saline mixture. That's what the little stethoscope adaptation is for too. Yeah.
And then my other question was, if you give it IV,
Yes.
if the dog has heartworms, could you potentially have an issue there? I don't, like, does ozone have an effect on, like, heartworms, other nematodes?
That's a good question. So I have read that it can kill some protozoa, but I think Jonathan, do you know if it would have any effect there?
It's not indicated for heartworms.
It wouldn't kill heartworms, if that's what you meant, but I think you're asking more, would it cause a reaction?
Yeah, I was worried, like, I didn't know what its effect would be on heartworms, and I know sometimes when we're doing heartworm treatments, if they die off, if there's a heavy load of them, it can cause a backup, and it can cause a clot and other issues, so I just wondered, like...
Yeah, that's a good question. Let me reach out to some of the more experienced veterinarians and I'll let you know. But my guess is that it would be fine. If you were doing a major autohemotherapy because of those secondary changes in the lungs, that's all from necrotic pieces of dead worm, and I think that's just going to help. Yeah, I would expect that would be the answer, but I don't know for sure, so I'll check on that. Yeah, good question. Yeah?
We're using it, like when you said that microbiome.
Yes.
Do you do the rectal ozone first then, and then you follow up the slurry?
Yes, I do. And the main reason is that, so you can do, I've been doing poop smoothies for maybe 10, 15 years. But when you give the rectal ozone first, and you basically start with a clean slate, it doesn't eliminate all the biofilm, but you want to get rid of what's dysfunctional first. I kind of think of it as if I'm going to treat a dog's ear, if I don't get the crap out of there first, and I just put my Exotic or my Mometamax or my Claro, it's not going to work as well because you're just putting your treatment on top of crap. And that's kind of the same thing in the colon too. You want to get that evacuated, and hopefully they also poop. So we usually do the rectal ozone, and we take them out to our exercise yard, and hopefully they also poop, and then we'll give the slurry.
Do you have to wait a certain amount of time?
It's so fast. I mean, really, we do the ozone and we run them outside. And usually it's within 5 minutes. If they're going to defecate, they usually do. And because the ozone is degraded so quickly back to oxygen, within seconds, it's not going to kill your new guys coming in. Only just in that flash that it's exposed. Yeah, so it's safe after that. Good question. Anybody else? Are you ready for lunch? All right. Yes.
You talked about the dog with the aspergillus, and if you have a cat, like with chronic rhinitis, or like a dog, that no other issue really has been found,
Right.
how would you administer, obviously not inhalant, but could you do nasal drops or...
Well, actually, I'm glad you said that. I had a slide that I wanted to add, and I just thought I was overdoing it for the second hour. Do you know what air muzzles are? They look like a hamster ball that has an attachment that you can nebulize through. It looks like a spaceman helmet. We put that on cats with chronic snot that are so frustrating. You do antibiotics and they come back, and you do different antibiotics and they come back. And we'll nebulize through olive oil with those kitties for 15 minutes, like once a week. I think usually 3-4 treatments. And then they go months without it, and people are so happy. And that's without any antibiotic. That's the only thing we're doing, and it's wiping it out. One thing that I wasn't, and we have another kitty just like Augie, that we did a CT scan. There's a mobile CT scan company. I don't know if you guys are aware of this in Michigan, yeah? So they came to our parking lot and did a CT on this kitty who I was sure had nasal carcinoma because he had bloody discharge from one nostril and starting to get facial swelling, on the side of the nasal planum. And he did show a space occupying mass or something. The CT people and myself both thought it was probably a nasal adenocarcinoma. It's going to be cancer. But the owner pushed me a little bit and said, what else could it be? And I said, well, it could be a fungal infection. So he wanted to send out for that, and the cat came back with aspergillosis. So we've been treating him with the major and the nebulizer, and he's doing great. He's doing great. So yes, you don't have to know exactly what it is. It'll treat both. And you can nebulize, and you could do drops too, but the nebulizer just seems to work a lot better. And most people have one of those air muzzles. They're cheap, easy to get. And what we have found is that the kitties are really willing to sit for that if you put them in their cat carrier while they're getting the treatment.
If you were to do like a rectal insufflation, would that get enough systemic to treat something else like that, or would you want to go directly?
In my experience, if I have a chronic sinus drainage, the rectal is really helpful, but I do think you need to nebulize also. And you don't have to have the fancy, additional chimp. You can do it just with the ozone generator. Yeah, you can do it with the basic equipment.
I just asked because we just had a cat relinquished to us for sneezing constantly.
Yeah.
And
Snot rockets.
It's been biopsy,
Yep.
except chronic rhinitis came back.
Yep.
It's not even really snotty. They're just they were just over it. And I'm like, I feel like there's more, maybe this could be something.
That would totally do it. I have no doubt that would fix it. Yeah.